Hello, bonjour. Hello, everyone, to our session, Building Access and Equity for Migrant, Immigrant, and Refugees with Visible and Invisible Disabilities. My name is Sihem Hammouda. I'm the bilingual coordinator of the Accessibility Initiatives, and I go by the pronouns ella, she, her, and I have with me my colleague Tecla Namusonge, and her pronouns are she, her. We will both co-present this uh, session, and thank you for coming here. We will start with the land acknowledgement. We would like to acknowledge this sacred land on which we, at OCASI, the Ontario Council of Agencies Serving Immigrants, carry out our work. It is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Before we start, some basic rules, and I do apologize for my voice. I caught a cold, so please forgive me for this voice. Please be respectful and accommodating to each other. Please remember to mute yourselves if you are not speaking to minimize noise. Enabling or disabling captioning subtitles. On the menu bar, click on Show Captioning, the CC, to enable captioning or disable it. Please use a Q&A option if you have any questions. Your questions will be addressed at the end of this presentation, and at the end we will kindly ask you to complete a short evaluation just so we know how we did. For today's workshop, we will go through the description of our project, the inspiration, the inception, the focus on the work that we do, our project model, how we are making difference, our achievements, and our vision of the future. We work at the Ontario Council of Agencies Serving Immigrants, and it was formed in 1978 as an umbrella organization and collective voice for immigrants serving agencies to coordinate response to shared needs and concern within Ontario. So we are the umbrella organization at Ontario. We are a registered charity governed by a volunteer board of directors, and we have more than 238 members across the province of Ontario. Our vision is a country of equity and social justice where everyone belongs. Our mission at OCASI, we champion equity and human rights for migrant and immigrants and refugees through advocacy, collective action, collaborative planning, research, capacity building, and information and knowledge transfer. We work at one of the OCASI programs and project, and our project is called the Accessibility Initiatives. It is a national and bilingual project that aims to enhance the knowledge and the skills of settlement sector so that they are better equipped to serve migrants, and refugees with disabilities and deaf people. The project entails the development of a variety of online professional development activities, tools, resources that are designed to assist organizations serving immigrants and refugees in establishing accessible and inclusive environment to make the organization accessible for all newcomers, while stressing the need for this organization to comply with accessibility laws while delivering effective settlement services to immigrants and refugees with disability and deaf individuals. The inspiration. So throughout various communities and historical periods, the treatment of individuals with disabilities has exhibited a spectrum from unjust to equitable. Canada, unfortunately, carries a credible history in its treatment of people with disabilities, During the late 19th and early 20th centuries, a prevailing trust in medical institutions played a central role in the separation and segregation of people with disabilities. This era witnessed the establishment of public facilities such as psychiatric hospitals, homes for the blind, houses of refuge, and church-operated residences, all of which actively contributed to the isolation of individuals with disabilities from the broader societal fabric. These institutions, while intended to provide care, inadvertently became agents of separations, fostering an environment where individuals with disabilities were isolated from mainstream society. The consequences of such practices extended beyond physical separation, often leading to social exclusion and stigmatization. In response to these discriminatory practices, people with disabilities and their advocates mobilizes against the prevailing trend of institutionalizations. This mobilization marked a significant turning point in the disability rights movements as it aimed to challenge the status quo, eliminate segregation, and foster a more inclusive society that embraces the diversities of abilities. The efforts of these advocates played a crucial role in shifting societal attitudes and contributed to the gradual dismantling of institutional barriers. Nonetheless, the historical context underscores the ongoing struggles for inclusivity and equality in the treatment of individuals with disabilities. The perception of disability itself has transformed across different schools of thoughts. Initially, the medical model perceived as a health issue required treatment or cure. So it's a problem within the body that we have to fix it. The social model redirected attention to societal obstacles that disable individuals, hindering their inclusion. So the problem here is not the body. We will not fix the body, but we need to fix the environment and dismantle all the barriers. In recent times, the ideas of neurodiversity acknowledges neurological differences as inherent aspects of human diversity. Simultaneously, the disability justice movement champions the rights and inclusion of all individuals with disabilities, emphasizing the celebration of diverse abilities and advocating for social justice. These evolving perspectives contribute to the cultivation of more inclusive society. طلع. During the span from the 1970s to the present, Canada has been a significant, has seen a significant shift in the legislative landscape, marked by the creation and continual refinement of laws aimed at safeguarding the rights of people with disabilities. These legal measures reflect a growing recognition to the importance of inclusivity and equal participation in society. A good and great and notable milestones in the international arena is the United Nations Conventions of the Rights of Persons with Disabilities that entered into force on May 3rd, 2008. According to this convention, individuals with disabilities encompass those with long-term physical, mental, intellectual, or sensory impairments. These impairments, when coupled with various societal barriers, can hinder their full and effective engagement in society on an equal basis with others. Sorry. This global perspective emphasizes the need for dismantling barriers that impede the complete integration of individuals with disabilities into various facets of life. In 1981, the United Nations declared the International Year for Disabled Persons, serving as a crucial moment that heightened awareness of disability issues on a global scale. These initiatives not only shed light on the challenges faced by individuals with disabilities, but also catalyzed efforts to foster understanding, compassion, and inclusivity in society worldwide. The ongoing evolution of legislation and international efforts underscores a commitment to creating a more equitable and accessible environment for individuals with disabilities in Canada and also across the globe. As society continues to progress, these measures play a crucial role in shaping a world that embraces diversity, recognizes the inherent worth of every individual, and actively works toward dismantling barriers to full participation and inclusions. On a national scale, within Canada, in 1982, an important amendment was made to the Charter of Rights and Freedom, explicitly incorporating disability as a protected basis against discrimination. The subsequent development in Canadian legislation further emphasized the commitment to addressing issues related to disabilities. The Human Rights Act of 1985 and the Employment Equity Act of 1986 played instrumental roles in this regard. The Canadian Human Rights Act specifically identifies physical and mental disability as prohibited grounds for discrimination. It further clarifies that disabilities can take on two forms. They can either be permanent, such as visual or mobility impairment, or they can be temporary, such as a treatable illness or a temporary impairment resulting from an accident, for example. In the realm of accessibility, the Accessible Canada Act of 2019 stands as significant milestones on a federal level. This legislation reflects a contemporary commitment to fostering a more inclusive and accessible environment for individuals with disabilities in Canada. The discriminatory nature of Canadian immigration laws towards immigrants with disabilities was notably evident in the Immigration and Refugee Protection Act of 2001. This legislation initially prohibited foreign nationals from immigrating to Canada if they were deemed to be suffering from any disease, disorder, disability, or other impairments, posing a potential danger to public health or safety. Moreover, admission was denied if their entry would or might reasonably be expected to cause excessive demands on health or social services. A response to persistent advocacy work, particularly championed by organizations like the Council of Canadians with Disabilities, a positive development occurred. The specific reference to disability was removed from the legislation. However, the controversial excessive demand clause remained intact. According to this provision, Section 38 1C, a foreign national could still be deemed inadmissible on health grounds if their health condition, again, might reasonably be expected to cause excessive demand on health or social services. While progress was made in acknowledgement, the discriminatory language, the retention of the excessive demand clause underscores that the ongoing challenges in achieving full inclusivity and equity for immigrants and refugees with disabilities within the Canadian immigration framework. Advocacy efforts continue to navigate these complexities and strive for a more just and inclusive immigration policy. Some numbers here about the disability in Canada from Statistic Canada in 2017. 1 in 5 Canadians aged 15 and over had one or more disabilities. 1 in 5. They are twice likely to be living in poverty. 21.4% of immigrants identifies as person with disabilities. Of the 6.2 million Canadians with disabilities, approximately 21.4% of identified of them identified as immigrants. 14.3 of people with disabilities identified as racialized, 4% South Asian, 2.9 Chinese, 2.2 Black, 1.3 Filipino, and 1 as Latin American. The realization of the compounded and systemic barriers encountered by racialized newcomers with disabilities, whether they are immigrants or refugees, especially among Francophones living in a minority context, is crucial considering the particularity demanding settlement process they undergo. Immigrants, refugees, and members of racialized communities face multiple systemic barriers to full and equitable participation in the social, economic, and political life of Canada. For immigrant refugees and racialized women, for example, racism, poverty, economic inequality, violence, and marginalization are amongst the most dominant predictors of poor health. Some of the barriers they are facing are the type of disability, the country of origin, the language they are speaking. Are they speaking English and French, or none of them, or only one of them? Or being, for example, only speaking French and they are living in a minority setting outside of Quebec. The culture they carry with them, their faith and background. Other barriers could be also the economic class, their sexual orientation and identity, their age, gender, pre-migration experience. Are they coming from a stable country? Are they coming from a war zone? Their immigration status, are they immigrant, refugees, protected person, etc.? Sorry. Also, there are other barriers like ableism, negative attitude, stereotype that we all carry, and we have to learn and unlearn them. Again, the poverty and economic insecurity, poor or overcrowded housing, other barriers, difficulty finding work, and this is commensurate with experiences and skill. The racism and discrimination, accessing the labor force, the housing, education, the high cost of secondary education, the lack again of English or French language skills, also the new stresses to family structure in their settlement journey, the busy lives in Canada. It is hard to find time for their families. Also, the culture shock, the climate change, the concern about immigration status, sponsorship. With all this, then came the Hammouda, the 2000, sorry, in 2005, the government, the government of Ontario enacted the Accessibility of Ontarians with Disabilities Act, Hammouda. So providing a comprehensive definition of disability and mandating that organization be ready to offer accessible and inclusive services to individuals with disabilities. The Hammouda establishes province-wide mandatory accessibility standards with legal obligations and clear timelines for implementation. So all Ontario should be accessible by 2025. These standards are designed to proactively address and eliminate barriers faced by individuals with disabilities, promoting a more inclusive society. Recognizing a need among settlement workers for additional knowledge in effectively assisting clients with various disabilities, OCASI has been motivated to collaborate with newcomers with disabilities their allies, and sector employees in the development and implementation of the accessibility initiatives. So, despite the existence of broad range of supports services for immigrant and newcomers to aid in their successful transition to Canada, there remains insufficient support for settlement workers catering to immigrants and refugees with disabilities. Consequently, individuals with disabilities continue to encounter systemic barriers when accessing services. This underscores the importance of enhancing support mechanisms to ensure a more equitable and accessible experience for all. So this is how the program took place. Between 2011 2013, we partnered with Ethno-Racial People with Disabilities Coalition of Ontario, ERDCO, for a joint program funded by IRCC. And the aim of the program was to bridge the knowledge and the capacity building between the settlement sector and the disability sector. We noticed that folks in the settlement sector, they know very well how to provide settlement services and integration to immigrants and refugees, but they have not enough knowledge about disabilities, what is disability, visible, invisible, how to interact, how to refer. And on the other hand, folks in the disability sector, they knew what is disability, but they lacked the knowledge of the specific challenges that a person who are migrant, immigrant, or refugees are facing in their settlement journey in Canada. So that was a partnership of 2 years where we did needs assessment and we tried to collect as enough data as we could to build the project. And then we were funded between 2013 to 2020 as a bilingual project. So at that time, we were only working within the province of Ontario. From 2020 to today, we were granted to go national. We are still bilingual, but now we are working on a national scale. Our focus is using an anti-racism and anti-oppression framework as well as disability justice lenses. And our works aims to three things. One, building the capacity of the sector when it comes to providing equitable, inclusive, and just and fair services to immigrants and refugees with disabilities. Two, awareness and advocacy. And three, changing the behavior by working on learning and unlearning our biases and stigma around disability, race, and immigration. We do this through our project model. We are doing this through evaluation. We created resources and curriculum. We are doing online training and creating resources. We have stakeholders that we work with to promote our work and to share more knowledge in a national scale. We have our National Accessibility Advisory Committee. They are volunteers that we recruit from coast to coast to coast. They are either people with disability themselves, immigrants or refugees, or experts from the settlement sector or experts from the disability sector. Their role is to guide and to advise us in our work on giving us advice on with which organization we should partner, which tools we should create, if we need any promoting for our work, they are there for us. When we develop resources, they went through them and they review this toolkits with us. We also have our partner. We need to know what is going on the other provinces. Yes, we are a national project, but we are from Ontario. We know more about Ontario, but we have less knowledge about the other provinces and territories. So in that way, we are partnering with the organization outside of Ontario, so we know what is going on there, and we can promote each other's work and exchange information and share more knowledge. And we have our program Allies in Accessibility. They are also volunteers who are recruited for 2 years. They are they are committed to share more awareness about the challenges faced by immigrant and refugees in their when they settle here in Canada, but also they are trying to spread more awareness within their own communities and sharing that with us. Their work is digital work, so they are doing that on our national community of practice. And yeah, this is our project model, and I will hand it to my colleague Tecla.
Okay, thank you so much, Sihem. So, as the needs of the sector continue to evolve, especially through the influx of newcomers and refugees coming to the country, so we try to strengthen our programming through through the evaluation component. So this helps us to improve the program better, so that we are able to meet the needs of the settlement sector and all our partners. And then also we are able to build organizational evaluation capacity. So we do this by developing a variety of evaluation tools and processes that can be shared by different programs. So also we also in our partnerships, that's also one of our aim, trying to leverage on what other people are doing, what other organizations are doing. Then we can borrow that to develop these tools. Also contributing to program accountability by meeting the board and funder requirements around evaluation reporting. So, for this to be more effective, we formulate indicators to assess relevance and impact, and these indicators we depend on what our benefactors what our benefactors suggest, and also what their recommendations say. And then we also incorporate necessary data collection methods into technology and outreach efforts. Also, we periodically analyze this data so that we are able to use the feedback to be able to improve further in our programming. Next slide, sir. So our next component of the program, we have curriculum and resource development. As Sihem had mentioned, we have this program that we have a professional development course that we have. So the program came about after a needs assessment was conducted in collaboration with the settlement and disability sectors and individuals with lived experiences. So we also involved community members, experts, and stakeholders in the review process to ensure that the feedback was comprehensive. Also, in addition to that, we have implemented pilot sessions and focus group sessions to assess the relevance and accuracy of the data we collected, and also the information that we collected in meeting the needs of the settlement sector. So we have our professional courses that are offered in both English and French. It is called Building Access and Equity for Immigrants and Refugees with Disabilities. So this course is offered 3 times a year, and each course is accompanied by 3 webinars, 3 in French and 3 in English. So the topics we choose based on also in the evaluation, what the settlement workers really think that it is more important to them. So we usually choose speakers based on the expertise that they have in the sector, so that they're able to come and talk to the real experiences of the people working there, and also the people will be attending the webinars. So far also we have developed 3 toolkits in both English and French. And also, just to mention, our toolkits are not translated. So, like for the Francophone, the French community, they develop tools that focus and meet the needs of the French community, and not translating them to be more relevant from English. So far we have gender-based violence against racialized migrant women, girls, and gender diverse people with disabilities and deaf people. So we have completed it, but we have not yet launched it. So maybe in the next few weeks, it will be on our website and you can be able to access it there. But right now you can access guide to the disability benefits that are available for newcomers and for newcomers with disabilities. We have an accessible version PDF on the OCASI website. Also, we have an accessibility toolkit called Access in Action. So this toolkit has best practices that settlement workers can refer to in their daily to-day work. And also in the same toolkit, you can find real stories by people with lived experiences. Also, we have legislation that are provided in that toolkit, both provincial legislation and national legislations. So it's a good reference tool for the settlement sector. Also, we have promotional videos and flyers just to speak up, which highlight the work we do generally in the settlement sector and also nationally, as we are a national project. So our online course is self-directed and it has 7 modules. So this is also based on also the need of the settlement sector. We totally understand that the settlement, the frontline workers have so much work to do. So this module was developed with that in mind, so that they're able to access the course whenever they have time and whenever it is possible for them, and it is totally free. And yeah, so also we have from the same professional development course, we also engage in the community of practice called SettleNet. So this is where settlement workers are able to network and interact with other colleagues in the sector. And also from the same SettleNet community of practice, the people are able to share best practices that other organizations and other frontline workers can learn from to be able to serve people better. Also, we have course evaluations that we conduct. So as participants go through the course, they're able to provide feedback that is necessary to help us make better improvements that meet the basic and practical needs of what they do in their daily life. So, for example, we were able to incorporate some of the feedback that were provided to develop the tools that we have developed, and also we were able to revise some of the modules, especially in English, so that it meets the standard and also the criteria that they desire to refer to when they are doing their daily work. So these are the modules that we offer. So we have module 1, it is Introduction to Anti-Racism and Anti-Oppressive Service Provision. And then we have Frameworks for Understanding Disability. Module 3 is about disability justice and non-Western concepts of disability. And then we have Unpacking Stigma and Bias about Disability, Race, and Immigration. And module 5 is about disability, immigration, and the law. And then we have gender-based violence, disability, and immigration. Then module 7 is divided into 2 sections for the frontline workers and also for the managers. So especially for the part of the managers, we believe there are some things, especially in terms of policy, when an organization has a push by the managers, most of some of these things may be implementable. So with that, maybe one example that come in mind is about like resource location. So when the managers are able to interact with the frontline workers, they're able to understand the needs better, and they're able to advocate for more resources and also for more inclusive services for the sector and also for their own organizations. So also we provide accessible webinars. So I had mentioned earlier, there are 3 webinars that we provide, and each webinar it's based on the course modules to meet the needs of the settlement workers. And then also the topics are selected based on the evaluation needs of the participants. And then also we complement courses with resources. So mostly when when we get these webinars, we do it we make them very accessible to ensure, like, maybe we have a language interpreters, ASL, LSQ. Also, we have captioners who we try to like include in the budgeting so that we are able to make them more accessible, because so that as the frontline workers serve the people with disabilities, they're also able to understand, like, what are the bare minimum they need to effectively serve. And then they're offered by subject matter experts and partners. So some of the webinars that we have provided so far, we have Accessible Canada Act, which came into action in 2019, and then Guide to the DTC and RDSP, which is the disability benefits that are available for people with disabilities in Canada. And then we have another webinar, Unpacking Stigma and Bias about Disability, Race, and Immigration. And we have Gender-Based Violence, Disability, and Immigration. So these webinars bring about the intersectionality that exists between disability and also with different barriers that exist, which shows that people with disabilities actually face more multifaceted barriers as compared to the able-bodied people. So they have to really, like, advocate for themselves more than any other group of people. Sihem, next slide. So yeah, so the next component we have is partnership, as Sihem has mentioned. So this project is a national project, and initially it was only in Ontario, and right now we are nationally. So we are trying to formulate partnerships with other provinces as well, so that we are able to share best practices and also just learn from each other. So with that, we have implemented partnership strategies to expand the project's reach, resources, and impact while incorporating new perspectives, ideas, technical expertise, and capacity building. So these partnerships allows us for the exchange of information, lessons learned, and best practices to enrich the project's reach. So also just to mention on the same point, so with these partnerships, we are able to see, like, what another organization does and what we do not do, and then try to bridge that gap with what we learn from each other. And then establish partnerships with umbrella organizations and organizations from both the settlement sector and disability sectors. So we have this component called National Accessibility Advisory Committee. So the purpose of it is to advise the project or concerning the development, maintenance, and stakeholder acceptance of the Accessibility Initiative project. So the advisory committee provide input on the process of developing projects deliverables based on their knowledge, expertise, and experiences in the areas of settlement and disability sector. So most of the committee actually is made up of volunteers who have lived experiences, are either service providers in the sector, and are advocates from the disability and settlement sectors. And we have a safe place for them to come and discuss all the emerging issues that are in the sector. And also the designated space for experts and newcomers who are francophone with disabilities living in a minority context. So we have a program also called Allies in Accessibility. So also this is a dedicated volunteer program where we recruit volunteers nationally to advocate for and strive for to advocate for inclusive, accessible, and affirming organizations that support newcomers with visible or invisible disabilities. So their work is to go out back to the community and able to educate the rest of to educate their communities on the importance of having inclusive spaces, and also providing services that are accommodative to all the people, and especially immigrants with disabilities. So most of the people who comprise of the Allies in Accessibility, most of them are immigrants and refugees with lived experience, settlement and disability sectors service providers. We have advocates, and then also we have francophone, and the group is that are both francophone and English speaking. So you can be either French speaking or English speaking. So their roles in comprises discussion forums on the community of practice, which is called SettleNet, and then community education and awareness raising, and then resource sharing and event training. So some of their impact we have had so far is they organize events such as Roundtable. Like last year, they did a roundtable with people with lived experiences and the sector on just to bring about the strength of people with disabilities and also what is being done there to be able to showcase, like also although there are challenges, but also they were able to showcase like actually there are milestones that need to be achieved. Although also we have people who are really doing so much as that's how they try to bridge the gap of the different various barriers that we still face as a sector, and also the barriers that people with disabilities face. So we have resource sharing that happen on the community of practice. And then we have they support webinar hosting. So based on their expertise, we approach them to offer webinars to the course participants, who are mainly the settlement workers and those people in the disability sector. Also, we provide they provide staff accessibility training. So according to the need of each ally and the organization where they come from, they're able to organize a session on accessibility and accommodation, and then we are able to support them to identify a subject matter expert who is able to come in and train the entire organization where they come from. Sihem, you want to do that?
Sure. Sorry, I had to unmute myself. So we are through all these components of the project and the work that we did and we are still doing with our partners. Our aim is that the settlement sector professional will acquire knowledge and skills and resources to provide, again, accessible and inclusive and equitable services to immigrants and refugees with disabilities in a way that make their integration into the Canadian society successful. Additionally, our project wants to enhance the organizational capacity within the settlement sector, enabling better responses to the specific needs of immigrants and refugees with disabilities, including Francophone living in minority settings. Another thing that we want to work and we are still working with is that immigrants and refugees with lived experience have benefited from the project resources. As you saw, they were included in our Realizing Accessibilities. You can find them in the National Advisory Committee. When we did the National Needs Assessment to create the national resources, they were included in focus groups and we did interviews with them. So they were actively involved in that, and we believe in nothing for us without us. And they are also encouraged to participate in our training and to benefit from our resources, that they are free and available online. They are on our webpage on OCASI site. So we continually encourage them to be part of the project and to provide also their comments, feedback and comments. Our key achievement since 2011 to today, we trained more than 5,000 folks within Ontario for between 2013 2020 and nationally since 2020. We are proudly awarded twice. We had the Canadian Race Relations Foundation Award as best practice in 2014, and we also get the in 2017 the prestigious David C. Only Award as leader in accessibility in Ontario. Our vision of the future is accessible spaces, equitable and inclusive services, and changing behavior. Le mot de la fin, as we say in French, last word, true inclusion is not about merely opening doors. It's about ensuring that no one feels the need to knock. Thank you so much. Here's the link to the evaluation. And if you have question, please do so.